most famous physical therapist on the internet.
Hi, folks. I'm Bob Shrupp, physical therapist.
Brad Heineck, physical therapist.
Together, we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today, we're going to talk about 3 best stretches to quickly remedy lumbar spinal stenosis and avoid surgery.
That's right, Bob.
So, who do we know, Brad, that's having trouble with this?
Well, Bob, yours truly happens to, but this is not uncommon, particularly with people past 50 years old, and we'll get into that a little bit.
By the way, if you're new to our channel, please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. Do we know what we're giving away, by the way? Someone tell us? Go to bobandbrad.com.
Sleep of bed.
Wow, we're giving away a bed. Go to bobandbrad.com. Go to the giveaway section. We're actually giving away an entire mattress.
That's right.
A Sleepovation mattress, 700 tiny mattresses in there. Most comfortable mattress. Brad, you can attest to this.
I certainly
got
can.
Back pain and you love it.
We both do.
Oh, yeah.
I mean, separate beds.
Yeah. You can go to Facebook. It'll also be pinned to the top of the page to pay contest. Go to Twitter, Instagram, or TikTok if you want a 60-second version of our program.
Watch this. All right, so spinal stenosis, in this case lumbar. So you can have stenosis throughout your whole
you can have it in your cervicals, in the neck.
And stenosis, technically, if you look at it, it just means a narrowing of a hole.
The hole was like this, now it's like this.
So you can have stenosis of your arteries or your veins.
Yep.
So we're talking about, we'll look at this. I don't have my little pointer here. But here, if we look at the spine, and we're talking about lumbar stenosis, we're talking about the low back. And if you look at spinal stenosis, there's 2 areas of stenosis that can cause pain in your back and going down into one or both of your legs. And we look right here. Can you zoom in on this, Tanner? Where this nerve, here we got a nerve coming up, peripheral nerve we'll call that, which does go down into your leg. Now the gap right here is called the foramen. That actually starts to close up. It may be because your disc, as the aging process is deteriorating, which pretty much happens in everyone. Or it could be some bony
overgrowth,
arthritis, calcification going one way or another, but the nerve gets pinched because the hole that it goes through becomes smaller or stenotic. That can also happen with the spinal cord. It's hard to show in here, but if you look at the...
Yeah, in a spinal canal, you can...
There you go, Bob. That's right.
Right here, Brad, you can kind of show
There you go. Yep, in here. But it happens, more often.
Lower, right.
Lower, yeah. When that happens, oftentimes the pain or the symptoms will go down both legs.
Yes.
One way or another, there is, worst case scenario, surgery that typically can help it out. However, I found out after doing a little research that most of the time, vast majority of the time, you don't need surgery.
Right.
So that's good news.
Because it can get inflamed, and once the inflammation calms down, it has enough room then.
Yeah.
But with the inflammation, there's not.
Right.
And also certain movements can bring it on.
And that's what we're going to do, is show you exercises that increase that gap and make it even more a less chance yet of having surgery. So we got to get rid of the spine here. I'm back now. So let's go into, there's a 5-question self-test that you can take for this. It's not a definitive test, but it'll help give you 4 of these answers are yes. Out of the 5, there's a pretty good chance you have stenosis.
Spinal stenosis.
Right. The first one, if you have bilateral or pain or symptoms down both of your legs, if that's a yes, then you just put a yes down.
Right, you're definitely...
Okay. Well, there could be other things, but yeah. And as all these combined, number 2, if more leg pain than back pain. So if you got, and sometimes this leg pain can feel like a toothache, a numbness, a tingling, all those symptoms. If you have more down the leg, one leg or both legs, and not so much up here, that's a yes, if that's the case. You check that one off. Number 3, if pain gets better when you sit down.
Yes.
And I've had a lot of patients, including myself, boy, you sit down and within not hours, but within a minute or so, it's like, oh, sometimes right away.
Relief.
Yep. Number 4.
You missed number 3, Brad. pain with standing or walking.
Yeah, how could I miss that one?
Yeah.
Very typical. People find
Standing straight.
Yep, standing up straight, or like if
Walking
you're
straight.
walking, if you were shopping, yeah, you hold on to the grocery cart and you find that leaning forward onto the cart feels better.
That's a dead
yeah,
ringer there. But
yeah.
I'll tell you, they call it shopping cart syndrome actually, because you actually feel better when you're
Yeah.
walking with the shopping cart.
And then if you are older than 48, now we've had Bob read something older
Over
than 55.
and-
Whatever. If you get up into your 50s or older, there's a more chance that you know,
Yeah,
this is
I
gonna
saw if
happen.
you're older than 55, and if you did this, and you go up like this, and that would increase your pain.
Sure.
That was spinal stenosis
Yeah.
because you're closing up the gaps there.
So there's different information out there,
You're
but
right.
of those 5 questions, if 4 of them are positive or yes, there's a fairly good chance you have stenosis. So the other thing is, if you're having leg symptoms on one or both legs and it's sounding like stenosis, and you're having problems with your balance, or if you had a history of falls, you need to go see a doctor. Don't go through this and try and fix it. You need to see, if you're falling, figure out what's going on and you have these symptoms, get it checked out, and then maybe see a therapist directly, because that's getting more serious.
Right.
So if you're having these symptoms but you feel functional and you're sitting down and it feels better, here's one of the stretches. We got 3 stretches to do. These are relatively easy, particularly this first set. You can do these in your bed before you get out of bed. If you can lay down on a carpeted floor, that's a good option as well. The first one is just start with a single knee to the chest. Oftentimes, if it's the right leg that feels the pain going down just one leg, that leg going up by itself may feel better. In my case right now, oh yeah, that feels better. Make sure you do both legs, and it may take both. And we do suggest do both knees coming up, because that helps open those gaps up on both sides. You got anything more about this, Bob?
That looks good to me.
You can hold this 15 to 30 seconds, depending on how it feels. If it feels better to get motion and go pressure on, pressure off, 10 repetitions is
Again, this
probably
should
good.
feel good though. If this is causing increased pain, you're stopping.
Right, there's something
Or
else.
even increased pain afterwards.
Right.
You
You do 10 and it feels okay or a little bit better, but then you get up
and it's actually worse.
and it's getting worse, and over the next half hour you flared it up. Well,
Yeah.
So yeah, be really aware of how things respond after the exercise. And if those help and they stay good afterwards, you can do those 3 times a day, I'd recommend.
Sure.
And possibly more, as long as it continues to feel good. The next one, the 6-inch roller. Now this one I learned taking a continuing ed class.
He's got a foam roller.
Yep. So this one you need to do on a floor. You're not going to do it in your bed for sure.
Yeah, you need a firm surface.
Yep. Carpeted floor. I would not try it on a smooth floor. You could do a rolled up towel that was rolled up tight.
Really? Yeah.
But these work a lot better. Now, what you're going to do with a foam roller, it works better if it's a little bit softer. They have a lower density. But even a hard one, that's usually they're black in color, they're a little more firm. That'll work. This is a little more comfortable. You put it down below your belt line onto the sacrum, the lower part of the sacrum, not down in here where it feels like it's going to fall off. Yeah.
The sacrum is a triangle right about here.
Yep.
So that can kind of give you a little bit of a hint of where the location is.
So you'll go like this, and you know it's in the right spot because it's going to feel good for one thing. And if it feels like it's falling off like that, you need to bring it in a little bit closer, not much, ½ inch or so. And this, though, what happens is a roll kind of helps gap those facets or those framing. And if you push a little bit like this and roll it, it actually, what I do is, I'm going to expose a little bit of myself here. I'm going to go right on my skin because it grabs a hold of the skin, and that actually feels good. It kind of gaps and pulls the foramen apart.
Almost like a little traction there.
Yep, exactly right, Bob. Yep. And you're going to do that, like right now, this is feeling really good, and I could do this for about 30 seconds easily until I get tired. And you're going to work with that, for a few minutes, do that a few times a day. Now, this next exercise, number 3, it's going to take a little bit of not special equipment, but a pull-up bar where you're going to use the hanging handles, but a pull-up bar that, and you're going to actually put some traction through your back by hanging. This is no new science or anything. It's been around for a long time. There's one thing I've found. I haven't seen this anywhere.
I haven't heard of this either, Brad.
But I know it works for me. So
I thought this is a cool idea.
So first of all, if you have a pull-up bar, grab that. If you have hanging handles, it works better yet. It works good to be up against the wall.
Up against the wall, and plus you can, if you have the hanging handles, you keep your feet on the ground.
Yeah, yeah. You don't want to have something you have to jump up to get. So here, and then you slowly go down,
and you still can have some weight through the feet if you want.
Yeah.
And then if you want, you can progress to no weight.
Yeah. And assuming your shoulders tolerate this. Typically, it's good for your shoulders if you got reason, and that's a whole nother topic we've got videos on. But I can actually do this. But the key part about this is you have to be able to relax your core muscles because they're going to allow the spine to get that traction and open up those frames.
If they're tightening up, you're not actually getting any traction.
Right. If you're going and you're all tight, it's not going to work. You need to relax, let everything relax. Now, what I've found is if I put my feet right here, and that actually lets me relax better, and it flexes the spine just like the previous exercise.
See what happens if you're hanging and you're having to lift the legs, those muscles are tightening up and pulling on the spine.
Yep, exactly.
So this is relaxing the muscles of the legs and relaxing the stomach and abdomen, and you can just let it hang. That's a brilliant idea, Brad.
And I can do a little this, or I can go up to this level. I at home, I've done it. I don't have a stool like this.
Just make sure you got enough strength to hold on that you don't end up falling.
Yeah, absolutely.
Land on your butt.
Yeah, this is not one to do if you're concerned about that at all. You need to feel confident in hanging.
Hanging, right.
Yeah. So I typically only hang 20 to 30 seconds at the most. When my fingers are starting to become tired, I just, I don't even try to push it.
So what do you call it? The Heineck hanging method?
The Heineck maneuver.
The Heineck maneuver.
Not to be confused with the Heimlich maneuver.
It's the Heineck maneuver.
Right.
There we go.
It feels good now. I've got spondylolisthesis, by the way, so that's why I have at this young age. Well, I guess I'm 58 now, but I had this when I was younger.
Young age.
Well, I'm trying to be optimistic, Bob.
To find some dirt that's as old as you. So
why, Bob?
By the way, if you're new to our channel, you gotta. Oh, we did that part already. I was gonna say.
Talk about
we can fix just about anything
except for
a broken heart.
That's right, Bob. The hanging isn't going to do a darn thing for it.
Thanks.
Be careful.